Now let's go.
So welcome on site. My name is Patricia Thuku, your daily Bliss reporter on health matters. So today on site, I wanted to talk about a disease that has been there for some time, but the society has not yet given it the light it deserves. So flow with me, get educated and get entertained as we discuss health issues.
Now let's go.
Today I wanted to discuss about the lupus condition. Remember, this is a condition that has been there for some time, but the society has not yet given it the appreciation, the understanding, and they do not perceive enough knowledge when it comes to handling lupus condition. So let's start by understanding what lupus condition is. Lupus is an inflammatory autoimmune disease where the immune system of an individual starts to attack the organs of that particular individual and the tissues, and this makes the person vulnerable and highly susceptible to diseases, especially during breakouts. In Kenya, there has been a professional delay in the recognition and diagnosis of lupus, and this has been due to inefficiency of our medical system coupled together with health system deficiency and inability of patients to recognize lupus symptoms. This has also been geared on by cultural barriers and beliefs that people have when it comes to lupus condition. This has been tied to lack of lupus understanding in the society, tied together with traditional remedies and the stigma that lupus comes along with, especially a person gets it in our society today. And it's time that we discuss lupus to ensure that members who are hiding back there or people who are actually fighting lupus underwater can have the ability and comfort to actually stand up and be warriors to lupus, especially now that the month of May every year is the Lupus Awareness Month. In Kenya, there has been a professional delay in the recognition and diagnosis of lupus patients. This is due to inadequate training of both the primary and the secondary care medical doctors in the country. Lupus care has also been described as too costly and expensive, and this is in comparison with the basic income of a normal Kenyan citizen. According to the data from the Ministry of Health Kenya, around 80 to 90% of lupus patients live fully to their normal lifespan, while those with organ-threatening symptoms can go up to 40 years, and this differs from person to person depending on the ability for them to get special need and care for lupus. Unfortunately, in every 10 lupus incidences in our hospitals today, one is only a man, as lupus condition is mostly related to women. 70% of the patients who are recognized to be having the lupus condition do not actually know that lupus exists, and this creates an urgency to create a lupus discussion platform, especially now because May is the Lupus Awareness Month. Common and prevalent symptoms that are present in patients suffering from lupus include fatigue, fever, joints in pain in the joints, stiffness and swelling of the body organs. We also have a butterfly-shaped rash on the cheeks and on the bridge of the nose. Patients also experience skin rashes that get serious when they get exposure to the sun. Fingers and toes that turn white or blue when exposed to cold or during stiffness. They also experience difficulty in breathing, headaches, confusion, and loss of memory. Amongst the many causes that are related to lupus, lupus does not have a real type or a well-defined cause, and some of the causes are just a relating factor. For example, we have too much exposure to sunlight, which creates skin lesions and reactions. We also have too much use of medications, and on medications here we're talking about blood pressure medication, anti-seizure medication, and antibiotic antibiotics. So at this point, the body starts reacting towards these things when they get exposed to their bodies. Some of the risk factors of lupus include one, sex, and as we've discussed is that lupus mostly affects the women, but that doesn't mean that it cannot affect men. But the percentage of men compared to that of women, that for women is much higher. Another point is age. Lupus mostly shows its symptoms to persons between the age gap of 15 years to 45 years. And finally, we have race. Lupus is most common in African Americans, Hispanics, and Asian Africans, and it is believed that Africans do not actually depict lupus symptoms that much. Some of the effects of actually having lupus and on the part that it attacks the major body organs like the kidney, the brain, the lungs, and the blood vessel is you can actually suffer from kidney failure or the kidney damage. Secondly, you can also suffer from brain and central nervous system, headaches, dizziness, behavior change, visions problems, and loss of memory, where you notice that most of these patients cannot be able to comprehend and keep information in memory for a long time. Lupus also affects the blood and the blood cells, and when it affects the blood, you'll notice that these individuals actually have low numbers of red blood cells, a condition that is referred to as anemia. These patients also go through blood vessel inflation, where the blood vessels tend to widen. They also go through too much bleeding, especially when they are in a situation that causes bleeding, for example nose bleeding, or when they suffer from cuts. When it affects the lungs, there is increase of chance of developing inflammation of the chest cavity, and this makes breathing too painful for the patients who have lupus and it has attacked their lungs. It can also cause bleeding in the lungs, and to some severe extent these patients actually suffer from pneumonia. When it attacks the heart, there is the fear for the chances of the inflation of the heart muscles, arteries, or the heart membrane. And this, the risk of cardiovascular disease and heart attack actually increases for the patient. Apart from those, there are some of other issues that are related to lupus condition. And one, you notice that lupus patients are highly vulnerable to diseases and infections. This because their immune system actually does not have a target antigen, and then it ends up even harming the antibodies that are responsible for fight against diseases. Secondly, they are at a high chance and risk of getting contracted with cancer. Thirdly, we have the bone tissue death, and this actually happens when the supply of blood in the bones is limited, and this causes the bone to break into tiny pieces, and finally this bone gets to a point of collapse, and this actually affects the patient to points where they actually lose their ability to maybe stretch hands or even walk. Finally, we have the pregnancy complication, and with this, it is advisable if a patient actually has had a lupus history or are depicting lupus symptoms, it is advised that they should not actually get pregnant until they are 6 months deep into the lupus treatment. This is because there are high chances of miscarriage, issues to do with the blood pressure, and a lot of these ladies actually suffer from preterm birth. In conclusion, unfortunately, lupus does not have an existing cure. That doesn't mean death to the patients who have lupus, as this condition is manageable and one can be able to live fully to their normal lifespan if only one adheres to the treatment related to the part of the body that lupus has affected. For example, if it affects the kidney, you can go to dialysis and actually become normal. If it has affected to the heart, you can be able to get the subsequent treatment to heart conditions that are related to lupus. For those who have lupus condition and who want to get pregnant, that doesn't mean that you cannot get pregnant, as the professionals have advised that you can stick to 6 months serious treatment of lupus, and from there you can be able to conceive. So that has been all for lupus today. I have been your host, Patricia. Until next time we meet, have an awesome time.
Now let's go.